terms of the NHS, but what about social workers? Because a number of them across the UK say they haven't been given this equipment yet, even though they are key workers and they're expected to continue working and visiting people who may have COVID-19. Problems as frontline healthcare workers with a lack of this protective clothing. What support are they getting? Will this be improving?
Hi, Emma. Yes. What we found is that at the moment, social workers aren't having access generally to personal protective equipment, so the gloves, the masks, the hand sanitisers. We know this is a problem across the NHS as well. And social work is obviously a pretty hard job often anyway, and the lack of both equipment but also the lack of clear advice and protocols about how to continue to do their really important work, going in, seeing families, making sure that children and adults are safe throughout this period. There's been a lack of specific national guidance for them, so specific guidance about keeping themselves safe in that environment, keeping the people they're working with safe from any risks of them carrying the virus, and then actually a lack of access to equipment. So we are seeing some more equipment and coming into social care more generally, particularly going into care homes, and the government has made a commitment to spread that out. And we're seeing some social workers, for instance, in mental health, beginning to see having that equipment there arriving in their offices. But, it is causing a lot of anxiety, and, we've had members and other social workers around the UK actually telling us that they're having sleepless nights about how they're going to maintain contact with children, where they're concerned about child well-being or adult well-being, domestic violence, drug use. And some of these problems we fear will rise because the self-isolation is going to put additional stress on some families. The social workers need to be able to do their work throughout this period, and of course we need to have a strong, resilient workforce at the end of it as well.
Let's bring in Wendy, an independent social worker who works with schools in West Yorkshire, and also Dorothy, a frontline child protection worker in the West Midlands. Welcome to both of you. If I just come to you, Wendy, first, you work primarily with schools. What impact is the closure of schools having on vulnerable children?
It's having an absolutely massive impact on vulnerable children. About 2 weeks ago, I had a number of social workers who I supervise in school who felt absolutely sick about the rumours that schools were going to shut. Absolutely, as Ruth said, sleepless nights about what would happen to those children who were really vulnerable or at risk. We really welcomed the announcement that children would still be able to access school if they were vulnerable or if they were the children of key workers. Unfortunately, that remains the choice of a family, or indeed the ability of a family to get a child there. And also, unfortunately, many children who are absolutely at risk and in need do not have a local authority or what we call statutory social worker. So in many ways, those children who are on the borderline of concern are really the most vulnerable. They're in the most difficult position. So we had a lot of quite frightened children, and we had a lot of social workers in schools who were really worrying about what we were going to do to try to keep those children safe when we did not have sight of them every day.
And so what is the upshot of that? Are you able to keep sight of them? How has it played out over the last week?
It's been really, really difficult. Ruth's absolutely right that there hasn't been a really clear directive. We really haven't used our initiative. We're working with our absolutely amazing colleagues in education. Schools and teachers have gone over and above, but we have had to be amazingly creative. We're very fortunate in community-based and school-based social work that we often have very clear contacts in the communities and relationships with families, and we can speak to them, but we've really had to make it up as we go along in some ways. We certainly, up until very recently, and this will continue until some help comes in, we've been making up food parcels, getting things like that out to families on foot, trying to have sight of the child when we drop off the food parcels, trying to ask parents if there's anything else that we can do to help. We're trying to remain in school when schools are open. Often really worried about, we don't have any protective equipment. We don't have hand sanitizer and things like that to go out on these visits where we're not really in the house. We're having to step back, social distance. While we do that, we're trying to make sure children have access to phones. If they're phones that won't be worth anything, some families, unfortunately, and this is not all families are in this situation at all, I must stress that, but for some families, children are incredibly vulnerable. And if they're in a situation, for example, where there's domestic violence and mental health and drug addiction, their phone might be valuable and they might not be able to keep hold of that to get hold of a social worker to ask for help or to speak to someone. So that's really at the far end of the spectrum. But other children are just very worried. They might be just need to phone the social worker.
And being able to get in touch is difficult at the moment. Dorothy, to bring you into this, first of all, have you been given protective clothing?
No, not protective clothing, no.
You don't have that at the moment, so you're still expected to do your job without it, which means, of course, seeing people and trying to look after them.
Yes, about a week ago we were given a flask and a bar of soap. Oh, and very kindly some blue towels to dry our hands on.
Right. Are you concerned that perhaps some of those who do need your services are in a situation now where they may be using self-isolation as a way of keeping social workers out of their homes?
Yes, I'm a frontline social worker, so most of my work is with families that don't want to engage with us anyway because they don't see the risks and the worries for their children. So in a way, this gives them a good respite from us, an excuse to not engage. And I'm not saying that's the case for all families, but those that we are most worried about, that we are going to struggle to get to see, for me, I'm really concerned for some of my families in regard to how I'm going to get to see the genuine situation for the children. So, for example, we are following government guidelines on narrowing down visits as much as we possibly can. But that doesn't mean to say we're not staying in touch with all our children or our families. What we've been doing is looking at a RAG rating system. So those that are most vulnerable, we do wish to continue the face-to-face visits. And for others, we're using media like WhatsApp, which for some children is quite good. In fact, one child's connecting with me better that way because it's on their medium platform, whereas beforehand she wouldn't take her eyes off her phone to talk. So that has been useful in one aspect. But yeah, you can't replace face-to-face visits to be able to get a feel of what's going on with the family. So I'll give an example. For families where children are experiencing domestic abuse and violence in the home and parents aren't recognising the impact of this to their children, we've been told to for WhatsApp calls, if we can get the families to show us around the house, well, that's all well and good. We might get shown into every room via the WhatsApp camera, but that doesn't mean to say that the perpetrator's not moving around room to room and we won't know he's there or she's there. So for us, it's very difficult, and we don't know that any of these conversations with children are completely private for the child and that there isn't a parent in the background listening. So, no, they're not great.
And also, is it correct that you can't do the tests to see how much alcohol is in people's system at the moment? Because, of course, substance abuse is a big issue that you have to look at in terms of the caretaking of children.
That's right. Part of my job, sadly, is looking at whether children can remain with their families or not. And then when we go through a period of either care proceedings or what we call pre-proceedings to try to help resolve issues before we get to that stage, we would quite often with families where there is alcohol use or drug abuse, look at testing, either through blood or hair strand testing or liver function tests to be able to understand the extent of the problem and offer the right support for families. However, we did have an email come out saying that the company we use isn't doing any more at the moment because, of course, this is very intrusive, taking blood from people. Yes, at the moment, I don't know where we're going to go with that.
In terms of doing your job day to day then, Wendy and Dorothy, do you feel safe doing it at the moment? I know that you're talking a lot here about the safety of those that you're trying to look after, but Wendy, do you feel safe going to work? I mean, a bar of soap, no protective equipment. It doesn't sound quite like you're being treated as frontline workers in the NHS.
No, and that's not uncommon really in many ways. Health and social care are inextricably linked, but social care has always been the sort of Cinderella service in many ways, and that hasn't changed. But this, we definitely don't feel safe. No, especially because our own family, a lot of the social workers I supervise in schools, they're having to, their own children are with maybe elderly relatives who are vulnerable or in school settings themselves, and they're obviously seeing families and having contact with children, and they're frightened about the risk of the virus. So definitely, we shouldn't have to be buying our own hand sanitizer and soap. Definitely not.
And for you, Dorothy?
Yeah, so for me, I'm not overly worried in the sense that my local authority has been very good at, well, they were to start with, a bit like headless chickens to start with, but after a while they've got their act together and have been very good at upgrading the IT system. So most of us are working from home. I'm working from home at this moment, and we're only going in when we're on duty, which means we're structuring our visits, trying to only go out in the community on the one day of the week. So we are trying to narrow down how much we're going out and about to protect ourselves. Yes, I am a little worried in regard to not having protective equipment going into homes. Very kindly, our advanced practitioner did go out and she sourced through Facebook on the free site some protective equipment for us in regard to gloves. But there's only a few of those in the office. We'd have to go into the office to get them, which we're not supposed to do. I personally dye my hair, so I have my own dyeing gloves at home. But then how sterile and protective are these things we're using if they're second-hand and coming out that way? So, yeah, I'm not
Wendy,
doing many
Dorothy,
visits.
thank you for... I was just going to say thank you so much for taking the time out of your work this morning to talk to us. And Ruth Allen there, Chief Executive of the British Association of Social Workers, because, of course, they're on the front line